live, Senators.
All right. Good morning. We are here at the Senate Education. I am in the wrong place. This is Senate Health and Welfare Committee meeting, and it is May 4th. And we are live. And Alex, do you mind taking the little, or can somebody touch the screen?
Got it.
Okay, good. Now we can see everyone. So this morning, we're going to take just a couple of minutes to look at the joint resolution supporting transgender youth and their parents who seek medical care. And Michelle, thank you for bringing us a new draft. Okay, so why don't we look at that together?
Okay, so for the record, Michelle Childs, Office of Legislative Counsel, and you should have draft 2.1 of a committee strike-all amendment to JRS 53. And the only change in this from the resolution as introduced is in the second whereas. So we're looking at lines 11 through 18. And this was just adding the Vermont healthcare organizations that had issued the press release, I think last week or the week before, in support of this issue. And so before I just had a few national organizations on there. So I just added those there. And then you'll see on line 17, after the word medical, I added the word care. Or it might have been on health after I added the word care, but
Healthcare.
But it's healthcare and medical care. So, and so those are the only language changes to this. A few other things I just wanted to circle back on with you is I believe, email everyone a list of the other states in terms of who has a current ban, in terms of the ones that have banned, which ones have been stayed pending litigation, as well as the states that have legislation that's moving. And so because of the reference to the 15 states that either have current bans or are working on bans right now that you mentioned in the resolution.
15, I thought it was 14. Did one more state add it overnight?
Did I change? I thought I'd have to go back and look. I think
That's okay. Maybe it was 15 and I had just 15.
I think what it was is there's 4 states that did it through legislation, and then Texas has done it through executive order in terms of directing that may be considered child abuse in that state, and so it wasn't through a legislative mechanism. And then a few things just circling back on some of the information you asked about for supportive documents. I believe that Jessica Oski had emailed you the list of resources and studies. That is more comprehensive than what I had used in developing the resolution, so I didn't send those separately to you. I did check on the date that Vermont added gender identity to our anti-discrimination laws, and that was 2007, just so you know that. So gender identity is a listed protected class in Vermont. Let's see, what else? You should have the DFR bulletin that is on your webpage if you need access to that.
Yes, and Medicaid.
And the Medicaid, yep, and the Medicaid.
Which has been in place for a while.
Right. Yeah. And so were there any other supporting documents or anything else that you needed?
I don't think so. Committee, is there anything else that you needed?
I just had a question about on the, I don't know which whereas it is, but it's on page 2, the whereas more than 1/3 of the 150,000 transgender youth. Where did that stat come from? How?
That's it. I can send it to you if that's not in the list that I think we've already sent over. There was a UCLA law school article that was written and looking at the different states that was issued in March of 2022. I think I didn't send that over to you because there are a couple of states that they had listed that in March 22 hadn't, like things are a little different now, even though it's only, a month, a little more than a month later, but I can forward that UCLA article to you.
Okay, and that's where the 150,000, that
Correct.
seems actually low to me, and that's nationwide.
That's in the 15 states.
Oh, I see, oh, okay.
Yeah.
So it's an estimate, and they do break it down and how they determine that, so you can see that, but that's just how many transgender youth they estimate in that age range in only those 15 jurisdictions.
Got it, okay, that
So
makes
it's like
more sense.
10,000 in each state, more or less.
Right, I mean, I think it's not evenly.
Yeah, I mean, Texas,
Then
have a lot of
And then
them.
Texas, well, we don't know. I mean, the other thing is that as these sort of bans go forward, then they'll be more restrictive and no one's going to be communicating their dysphoria. So it makes a big difference.
So also, and I know you guys have much more familiarity than I do with the, what is it, the Vermont Youth Risk Behavioral Survey.
Yeah.
But I do have an excerpt from that, and it's not separated out just with respect to trans youth, it's the LGBTQ. So I don't know if that's helpful, but I can forward you an excerpt from that in terms of the comparison between LGBTQIA youth and cisgender, youth that are in Vermont in terms of their.
That would be
reported
helpful,
risk.
because I know there are a number of risk factors associated with LGBTQ, and if this is another area of concern, we should probably have that. Yeah, okay. Anything else that you need, committee, you want? Michelle says she's got a well.
are you 1L or 2?
1L,
Okay.
but I answered to 2.
I always mess up. Okay, I would say, are there any other changes that you feel would be necessary to the resolution before we act on it?
I have just a process question. So this is a joint resolution, right? Right. So if we made a small change, or we pass it in the Senate and it goes over to the House?
It goes over to the House.
Mhm.
And my understanding is the House has different rules in terms of it does not need to be referred to a committee, so I don't know what the House's plan, excuse me, is on that, but it will go over.
Okay,
And so it could get referred to a committee or they could just vote it.
okay, so if they amend it, would it come back to us and then we, does that work?
I would say, I will have to check. It's been interesting because just going through the process of amending the resolution, doing these things, I've kind of stumped the administrative offices downstairs because I don't know in terms of that process, but I'll check for you.
Okay.
I think it can be treated the same as a bill, but it's possible that they could amend it, but I'll double check for you on process.
The main,
Attorney would know if.
He would.
yeah, I'm just wondering if we should check in with them about the language to make, if they can't amend it or what?
I think that the language that we've changed is not, is very minimal.
Okay.
So Senator, I really wouldn't worry about it.
Yeah, and it's late.
And they certainly, obviously, they saw it.
Yeah, they've been in
For
charge.
introduction and.
And having Vermont support is very helpful. So
Yeah.
I think that it also becomes less of a formal process when we know there's strong support in both the House and the Senate. So
Do we want it, a lot of the resolutions are sent someplace, do we want it sent anywhere?
Yeah, I didn't, so lots
We
of
don't
times it'll
have it
say,
sent.
send it to the Secretary of State or to somebody, honoring somebody. I didn't really
Yeah.
know who you would send it to. I can certainly add that clause at the end, but it seems like with more of a policy statement in this area.
I think it would be helpful to send it to, for example, the CDC. To send it to at a federal level, or let's think about that. Let everyone think right now. Where would you send? No, seriously, where would you send it? The Secretary of State, the Supreme Court, the.
Secretary of Health.
Yeah, well, that's why I
Let's
said
just brainstorm.
CDC.
Yeah, the
You know,
CDC.
Commissioner of Health, CDC.
Legislatures.
Congressional
States,
delegate
states,
Vermont.
legislatures.
I'm sorry. Probably the most good. Send it to Digger.
Well,
I
Digger
didn't hear
will hear about it.
I didn't hear what you said because of that. Okay, now I think, oh,
I passed that train on my way into work in Barry, that it was in Barry about an hour ago.
Oh, that's
They
sad.
only can go by 10 miles an hour.
Right.
so thoughts on Senator Cummings, I didn't hear what you said, then Senator.
No, I
All right, okay, Senator Harvey, go ahead.
I like the idea of the CDC.
Yeah,
Or the, yeah, and
we can do more than one, so
the US Department of Health, I mean, the
that would be, the
Federal Department of Secretary of
that
Health.
would be CDC, but I.
Well, the
you know,
CDC is under the Department of
And
Health.
Health and Human Services, which is.
How about our
Congressional.
congressional delegation?
Oh, yeah.
That's one.
I mean, the CDC is just gonna serve for the file.
What?
They're not gonna pay a lot of attention. Either.
We could check it and send it to, is it,
Just
who's the Secretary of HHS, is it Azar? Okay, okay, well, we could do
So
that.
you would like the Secretary of HS?
Yeah, I think that's good. And then, who else? I think it's important that this be sent somewhere, that
To show
people
support.
understand the significant disruption in people's lives.
Her name is Rachel Levine.
Levine.
Yeah,
Secretary of
I
HHS?
think so.
Oh, I think you're right.
Oh, wait, no, wait. She's the Assistant
Assistant.
Secretary of Health and she
Right.
is transgender.
Yes,
Okay, send it to her.
Yes.
okay.
Good find.
I Googled,
Yeah.
I was like, I've never heard of her.
That's good. Is there anyone else?
Wait, has she been confirmed? This was, oh
Oh,
yeah, it's 21.
Yep.
so
Yeah,
yes.
yeah, she's there.
Thank you. How sad that we don't know.
Okay, so with those changes, can we see those changes back?
Sure, so you want it sent to the Assistant Secretary of HS and our congressional delegation?
Yes.
And you don't need to separate CDC because they're within.
Is there a national organization that we should send it to? The
I think this is good. Maybe any other national organization might be construed as advocacy, so I think keeping it
Oh, I
in
see.
the governmental system.
that makes
Okay.
sense.
So I will add this one more to the end of the resolution, and I'll do that. I'll send it quickly through editing, and then I'll swing back your meeting the rest of the morning, or what time?
If we could get it before we're on the floor, then the reporter can take it up and submit it to the secretary's office, and the decision can then be made about when it's presented. It'll be
Sure.
either today or tomorrow.
But you're here for, I didn't look at the
We're
rest
here
of
until 9 o'clock, so,
until 9, like
Yeah.
now?
yes,
Oh.
so we're gonna talk with Katie, Jerry.
I think our committee conference is on hold.
Oh, okay, so we do have a little time.
Okay, I mean, I'll do it as quickly as possible. I just
Yeah,
wasn't
so if you
sure.
get back to us, we'll finish our work with Katie and.
What time is the floor?
10.
10, okay, all right, great.
All
All
right.
right, you got it soon.
Found my.
Hi, hello.
All
right,
right,
thanks,
Michelle. Sure.
my whole presentation.
All right.
Good morning.
Good morning. What are we doing with Katie?
We are going to, so we have all read what's come back to us from 195, I think, but Katie, why don't you help us with what the House has done with the
Sure.
bill?
Okay, so I don't think it's been posted yet. I've been talking to Alex, but if you go to, just type in S195.
I think it's on the calendar, is that what the House?
Oh,
back?
okay, it's
Yeah.
on the calendar, or if you just type in S195, it's the version, the House version that's posted.
It should be
so-
posted now.
There's some, okay, everyone's muted,
Okay.
thank you, okay.
I think it was Alex saying it's posted now.
Oh, okay, thanks, Alex.
So maybe just, I'll step back and give you a little refresher about what S95 did, because it's been a while. So S195 was the Mental Health Peer Support Specialist bill. If you remember, when it left this committee, it also, it had like the certification program, and it also had the peer respite. Senate Appropriations removed the respite, and just passed out the peer certification without any money attached to it. And then it got to the House, and the House decided not to move forward with this certification in that existing form, particularly as there was no money attached to it. So what you have coming back to you is first the finding section, which hasn't changed.
That's good.
And then a new section 2, which pretty much replaces the contents of the bill you sent over. So DMH shall initiate the next steps towards the creation of a statewide peer support specialist certification program through the execution of the grant for advancing peer certification in Vermont, included in the allocation of monies appropriated previously. And then on or before December 15th of this year, the department is to submit a written report to the committees of jurisdiction that incorporates recommendations of the grantee selected pursuant to subsection A and provides policy guidance and recommendations for any legislation necessary to create the program. Subsection C, the report required pursuant to subsection B of this section shall include input from the Office of Professional Regulation and DEVA regarding the options and steps required to seek Medicaid funding for certified peer support specialists. And the act takes effect on July 1, and then we're changing the title to be an act relating to examining mental health peer certification instead of.
So this is a significant difference from the legislation that we passed over to the House. And it's my understanding in email communications and talking with folks in the administration that they're now working, DMH is working with OPR and others, I think Wilda White in particular, her organization, to build a certification program without the need for this legislation. And Senator Hooker, you've also heard.
From people who've been working on this outside of the legislature saying that they feel that it would be a more effective way for them to work without putting this in its place. This just seems to put things off.
Close it down.
And so I don't think that this is helping the cause.
But you think there's enough that's happening already without this?
Exactly.
So,
Exactly, so.
It's getting away. So, so then the question is, for our purposes, if we think that things are happening outside, certainly the advocates who are working on this with the administration and Secretary of State's office are gonna come back with any legislative recommendations. And the
Secretary of State.
OPR.
Oh, okay.
OPR.
OPR, yeah, I should have said OPR. Oh, I never.
Department of Mental Health.
Yeah, okay, that works.
Together.
So, I mean,
Secretary of State.
we could send back a further proposal amendment. We could concur, or we can bring it back into committee for consideration. And if it comes back into committee, that essentially sends the message that let the group go on and do its work and the bill dies right here. So those are the choices that we have, or we could let it lie up on the floor and allow some time for thinking. We could just leave it.
What is the status of the other part of the bill? Is that on the wall and the ropes essentially?
Yes,
Yeah.
None of it.
The health, the peer support.
Support the peer respite centers.
Yeah.
Yeah.
I'm sorry, Cheryl. You were part of this.
But, I think this will be a step, they're working so that they can at least shore up the workforce for the people who need it.
Yeah.
That kind of
And,
help. And this, and having it go through outside of legislation seems to be a more effective way, a faster way
Yeah.
to get things done. So I think that they would be pleased to be able to continue their work without being hampered by having to wait for reports.
Yeah. Okay.
So,
Why don't we just bring it back into committee?
yes, well, last week I met with my police chief in my own town, as well as the chief in charge of the sheriffs and DAs. And they're very interested in this and having it go forward, but they also know that things are happening now. So I think the bringing it back here might be the best pathway at this point. But we need to make sure that we all agree on that and that we've had a chance just to think about that. Because we do have the option of letting it stay on the calendar for a little while. Let's have that discussion.
I'd say bring it back into committee.
Okay. Senator Hardy, you said you'd like it.
Either way, I think getting it off the calendar would probably be helpful.
Yeah, just
Not
Just,
confusing.
and it would not confuse people, so if we bring it back in the committee, it would get off the calendar. And
Yeah.
if we have no intention of passing it, it doesn't seem,
Not at this point.
Yeah.
And
you know,
Senator Cummings, your thoughts?
No, I think that's,
Okay, I'll do that.
Yeah.
So Katie, thank you for your work on this. It's not without product and it's not
No.
without
I think
success.
it's working its way through on a different track. That's all.
Yeah. So we're good.
Okay.
Is there anything else that you're working on that we need to know about? I think H720 has been the best for a conference committee.
Okay, that sounds accurate. I wasn't listening to the floor, but that.
Yeah.
page
Okay.
720.
Yeah.
Okay, so then I'll just name a conference committee and send that information to the secretary. Let me know if you're interested. I know who is very interested.
Cheryl.
coming back.
Pardon me?
You will have S90 coming back. It's up for third reading today.
So yes, I read what they did on S90 and I sent a note out to everyone about that. Josh and I both read it and looked at it and he's been following this very closely. He's done a lot of work on this and so I think go back and reread the note that I sent. I think S90 is attached to it as it comes from the House. If you have any concerns about it, we can go back and look at it, but just let me know if you are, your interest in concurring. I think both Senator Terenzini and I agreed that it would take us forward in the way we wanted to go. It's modeled more after the main law.
Yeah, I skimmed it quickly,
Yeah.
and it seemed to
Yeah.
seem to have improved, so.
So is it in the House now or has it come on our calendar?
It's up for third reading in the House today.
Third reading, okay, so we won't act on that until it gets over here, but that's a heads up. All right. Are there any others?
It's hard. I'm starting to lose track of where things are this point in the process. You're still waiting on S91, which is still in committee. That's the PCCs.
PCC.
They're going back and forth on it, I've been keeping track of that.
Okay. All right, we'll wait on that one. Okay,
Child advocate
Nothing
is
else?
finally out of the process.
Yeah.
Nolan, you just came on, so I'm thinking there's something you would like to share with us.
No, you were talking about bills, and I think 285 I think is done in the House too. I don't know what you're going to do about it.
Yes, no, I sent a note out to everyone this morning about 285 and Jen and I had worked to put together a proposal and Ruth helped with that proposal. So we'll be looking at a proposal for a further proposal of amendment. And I know that your interest in that is the $500,000. So I think just, if you don't mind just staying right there, and then after we finish here with Katie, we'll maybe talk a little bit about it, but I don't want to do too much on that until Jen is in the room with us and we have that proposal. But
Well, yeah, why don't you wait for Jen to be here then? And
yeah, she's coming in tomorrow.
okay.
Yeah.
I can be here then too.
Let me just, let's just go, let's go off YouTube for a minute and then we can get coordinated. We'll come back onto YouTube in a few minutes after Michelle comes back into the room.